TLX Dental team members. So we're here today to help you navigate to our office. Today I'm going to give you a tour to each room, which laboratory, so you can easy set up for your doctor and each procedures. So as you can see here, we have a map. Each room has a map, which has letters A, B, C, D, E, F, J, H, I, J. As you can see, letter A has composites, articulating paper. So for the letter A, as we have a letter A also on a drawer. Each letter has a drawer corresponding to it. So you can see letter A has 2x2, floss, lidocaine, everything you need for a composite setup. And of course, we are always trying to keep the drawers as organized as possible. That will facilitate your life and my life, of course. So make sure in your free time you always try to organize each drawer. If you don't have anything to do, always make sure you keep it organized. Very important. So as you can see here, we have a letter B, letter C, D, as follows. So letter B, we have over here section tips, high-speed sections, and also the syringe tips. Also, as you can see, we have letter D, C, and letter C, we have a Profi caps, and we have Profi paste and endo ice. So it will make it easier for you. So if you follow the map, you know exactly where the things are in each room. Here we have the patient goodie bag. In your free time, you should also try to make patient goodie bags. So each bag has a toothbrush and a toothpaste, of course. And we always give those bags to new patients or to very special patients. And as you can see in this drawer, we have letter E, which have fluoride treatments and fluoride trays. And again, trying to keep the drawer as organized as possible. Letter F, we have everything you need to take an X-ray. We have X-rays covers, camera covers, and everything you will need to take an X-ray. And very important between patients, very, very, very important. So the patient will feel comfortable with you. And here we have disposables. We have hand towels. We also have head covers. Always make sure that you change and wipe the rooms in between patients. Change the covers, put a new fresh covers on, and change the tapes, the blue tape. Always make sure you place the blue tape on them. Let's keep our office as clean as possible to avoid any contamination. And here, always make sure you place your mask if it's when you have a patient. And always make sure, very, very important, wash your hands, because the patient will feel comfortable if you wash your hands. The patient like to see that you wash your hands. So while you're talking to the patient's in a chair, always you wash your hands, and you can do all this while you're talking to the patient. So you wash, give a nice wash with a warm water, and you can do all this and talk to the patient. And always trying to keep, here we have this door, always trying to keep this door open before, so you don't touch anything. So you dry your hands. You can, talk to the patient at the same time. You don't have to stop. You always keep moving. So we'll keep things fast. So here you place your mask. Adjust your mask. Now you can choose your size gloves. and place your gloves on, and make sure the patient see you change the gloves and put fresh pair of gloves. It's very, very important that the patient actually see you doing all the steps, so the patient will feel comfortable with you. Another very important thing, if you look at this bag, trying to make sure that it always has brown or black. That means the instrument has been processed. So the patient feel comfortable, and always trying to organize the instruments on a table so it'll make the life of the doctor easier. Always make sure you give the patient glasses to avoid any instruments going to the patient's eyes or anything like that. It will protect yourself and also protect the patient. Very, very, very important. So when leaving the room, of course, change the gloves, change the mask, always. Okay, so another thing, we do need consent forms. Our consent forms are always located in the front of the door, over here. That's where the consent form is. Here we have a consent form for the filling. This is the consent form for the filling. We have consent forms for oral surgery. So all the consent forms are located in this folder. So make sure you always have a patient sign a consent form. It doesn't matter for what it is, for the filling, for an extraction, always make sure you have a consent form ready. And always carry with you an encounter form that make it easy for the doctor. So always have that with you. Always when the doctor tell you the procedures, always have a pen ready and an encounter form ready and write it down the procedures. So, and you can follow me, and we're gonna go see the sterilization room where all the magic happens. Come with me. Okay, and here we have an oral surgery card. So when we're having a surgery, everything that you need for the surgery is located in this card. As you can see, we have sutures, we have the blades, got 2 by 2, and now your surprise, surgical instruments. And over here, we also have